So we'll continue with this last session of DDL this morning, session 5, on the subject of future challenges and opportunities. And welcome to those people who are joining us online this morning. And also a reminder to submit your questions by Slido if you can't do that in the room. So we're going to start off this morning. I'll introduce our first speaker. Zorana Anderson is a professor in environmental epidemiology at the Department of Public Health at the University of Copenhagen, and she's chair of the European Respiratory Society Environment and Health Committee. She's passionate about clean air and translation of knowledge from research on health effects of air pollution to policymakers at local, national, and European level. She's also with the WHO, a Global Air Pollution and Health Advisory Group. So I'll let you continue from there. Thank you.
Thank you very much for kind introduction, and thank you for inviting me to speak to a little bit different audience that I'm used to on air pollution, climate change, and lung health, and health in general. So this is a little bit in continuation to a very nice presentation. I also have a summer house in Croatia, a small island, so we'll gladly talk. We can do some research together there and swim. So I would today like to give you an overview of major health effects of air pollution. Focus is on lung, I guess, with your profession, but I want to give you insight that air pollution health effects are well known beyond lung as well. So I want to give you that overview. Also tell you a little bit about some key publications and events going on now. WHO published this very important piece, synthesis of evidence on health effects of air pollution called Air Quality Guideline. I'll convey some key messages from that. This has kickstarted the EU Air Quality Directive revision. This is a revision of our major air pollution law in EU as part of Green Deal, our big climate ambition in EU. So this is ongoing now. And give you some also links to climate change and why this is really, for us, more or less non-separable agenda for air pollution. So air pollution story starts with the lung. We naturally, since air pollution is inhaled, first studied and understood how air pollution affects our lung. The key mechanism here is inflammation. There are a number of particles, gases in the lung coming from traffic, from industry, from wood and coal burning at home, from waste burning, agricultural activities, and so on. All of them coming into lung trigger inflammation as a key mechanism, and this we know from early on in life. Actually, even prenatal exposures set kind of lung development a little bit back, and because we are exposed to air pollution during our lifetime, and everybody's exposed to a certain level of air pollution, this can lead to increased risk of number of related diseases, which are related to lower lung function and optimal. So we know that both in children, air pollution increases risk of developing asthma, and then later during lifetime, this is a then lifelong risk. Air pollution increases risk of COPD, lung cancer, as well as infectious diseases related to compromising immune responses due to this low-grade constant inflammation. This is not trivial. The latest data from Global Burden of Disease show us that 40% of COPDs and 30% of lower respiratory infections globally, mortality from these diseases due to air pollution. So even for smoking-related diseases, COPD, there's a quite significant fraction due to air pollution. 16% of childhood asthma cases are due to air pollution. This is also a global estimate. In addition to that, we are exposed to peaks of air pollution during our daily activities. Maybe we live in villa, there's no air pollution in the suburb, but during traffic, sitting in a car on a highway or biking by busy roads or going in a metro or subway, we get maybe high peaks of air pollution exposure, and they kind of in daily life can trigger serious exacerbations mainly in lung patients. And they could be from wheezing, coughing, but they can really also trigger very serious ones with needing hospitalization or even trigger death in elderly and frail patients. And we had also a very tragic case of a little girl, Ella Kissi Debra, who actually died of one of those exacerbations of a very difficult asthma that she had. She lived in London in a busy street, had numerous exacerbations, hospitalizations, especially in the winter. She lived next to busy road and died one of those. And this led to a really historical court case, first ever globally, that confirmed that air pollution was a direct cause of death, since she didn't have any other risk factors for asthma, was born healthy. And what is important with this court case, that is really indirectly City of London failing to comply with air pollution limit values set by EU at that time, as well as lack of information to clinicians and nurses with mother. There was nobody at that time during all those admissions that mentioned air pollution as a possible risk factor for asthma exacerbations. And this is really something key to us at European Respiratory Society, that education of clinicians and patients is, and that we don't allow at this time and age that clinicians are not aware of health effects of air pollution, especially in children and asthma. COVID-19 also triggered a lot of interest in air pollution from some poor early studies showing correlation with northern Italy air pollution with COVID. This is not the case. Particles don't transfer air pollution, but air pollution increases risk of COVID. Now we have a number of good studies from Denmark, from Sweden, even with low levels. Again, as a pneumonia and lower respiratory infections, reduced immune response leads to increased risk of both contracting and poorer prognosis, increased risk of death and hospitalization. Air pollution leads to a number of other diseases. Through alveoli, air pollutants, the smallest of the particles, can transfer to the entire blood system, and through atherosclerotic processes that we know well from smoking, can lead to inflammation in the cardiovascular system, in the fat tissue, and leads to increased risk of number of cardiovascular outcomes, as well as type 2 diabetes. And also these are quite significant fractions of global disease burden due to air pollution, from 20 for ischemic heart disease, 26 for stroke, 20 for diabetes. Newest research also shows clear link with arrhythmias and heart failure. Cancer is another big issue right now, and EU has a large euro-beating cancer plan to tackle still unacceptable large number of deaths from cancer, and still not full mapping of the risk factors. This BACUP cancer plan and European Environmental Agency report related to this show that likely there is more in environment that we have mapped and studied that is causing cancer, and we need to map that better, and likely air pollution is a probably answer to this. It is so that International Agency for Research on Cancer has already in 2013 recognized that air pollution is carcinogenic, both diesel exhaust, particles, and a number of other components. And we knew at that time already with lung cancer there was a clear link, and 19% of lung cancer global mortality is due to air pollution. Now we see fast emerging evidence on a number of other cancer sites, and we likely will see established association with breast, liver, blood, stomach, and colon cancers and air pollution. And finally, the new research last few years has focused on impact on the brain, and we see also emerging number of studies showing that neuroinflammation in the brain can cause suboptimal development of cognitive function already in childhood, decreased memory, attention deficit disorders, and so on. It leads to faster cognitive decline in elderly. And just recently we had a big meta-analysis showing that now we have enough studies that show that air pollution increases risk of dementia. And some of the newest research now is focusing on mental health, and there are a few studies and more coming on suicide, depression link, as well as anxiety and air pollution. So this is just to wrap up. We have very many diseases, even though air pollution levels are relatively low in areas like in Western Europe where we are. It is because so many diseases are affected that this is really a huge public health problem. Everybody's exposed, not everybody's equally affected, and of course children, pregnant women, elderly, chronic disease patients, especially lung patients, and poor. There's a big environmental injustice issue here, especially in Eastern Europe, and within countries that the poorest people live closest to the sources or have no means to heat up or cook than using coal and wood and so on. So these are the special area of interest for us to protect these groups. So WHO publishes this large synthesis of evidence on air pollution. This is what EU uses as their synthesis of evidence in creating new laws around air pollution. And this is something we have waited for a number of years, and in 21 this came out. What this report does, based on the evidence and new knowledge of air pollution, sets so-called guidelines on air pollution levels. And the last time they did this was in 2005. And the major message here is that there's so much new evidence developed that air pollution now guidelines have been set down 4 times for NO2. This is a traffic-related gas, from 40 to 10. So 4 times smaller, and for PM2.5 from earlier 10 to 5. So this is recommendation to policy governments around the globe to set the limit values for pollutants in order to avoid health effects from them. So they need to be very much lower than what they recommended in 2005. From recommendation for policy, there's a still big gap in EU right now. We have the current air quality directive sets PM2.5 value of 25. So this is a big gap between that and what is evidence-based suggestion and to 5. So we know that even well below 25, which most of us now live at those levels in Europe, we have major health effects. So current legislation really doesn't protect us from air pollution, and limit values are way too high also for NO2. So that's our, this has been the motivation for air quality directive revision, and this is really ongoing now. It's been almost 2-year process, and right now Council has a trialogue negotiations with Parliament and Commission, and we are very hopeful we'll get new laws. Current proposal is to set PM2.5 at 10 and NO2 at 20, which is better than what we have now. And similar processes going in UK and Switzerland and non-EU countries as well as US. We have gathered a number of scientific communities. I work for European Respiratory Society, but many have supported our statement, our urging to policymakers to simply listen to science and implement the guidelines as a policy. That would makes most sense, and that's a clear message to EU policy throughout the process. So just quickly, the main messages of those air quality guidelines are that since they became lower, we know that everything above 5 for sure is dangerous for us. We have enough studies now. That means that we are all exposed to dangerous air pollution level. Unless you live in a small cities in northern Norway, everybody has mean air pollution. This is annual mean more than 5, and this is really alarming. So many diseases, we have risk factor that everybody's supposed to, although the risk to individual are quite low compared to smoking at the levels we have, for example, in Edinburgh today or Copenhagen, where I've come from. But because everybody's exposed, you can quickly see a calculation that this is a significant number of deaths and diseases at population level. Globally, there are even higher levels in Southeast Asia, and there are hotspots, of course, around the globe that we have to be aware of. And globally, 99% of population is actually exposed to air pollution. We also see huge disparities, tenfold differences between cleanest countries in Western Europe, Canada, US, and the dirtiest country that right now is India, has the highest air pollution level, about 80, where we are around 10, for example, in Edinburgh, Copenhagen, and so on. And we see increased disparities in burden. Air pollution level is one thing. How many people die of air pollution prematurely? That's increasing, especially in countries that are most polluted, also due to aging and other elements in these societies. Another key message from WHO is that there's no threshold below which air pollution is safe. So of course we have this 5 as recommendation, but we have few studies that go even below 5 in Denmark, and this is a large, very important EU study that came out. And this is a key message. So most of us now live, this is European study from a few years ago, we all live somewhere here between 25 and 5. We see huge health effects. This is a dose response curve with premature mortality, and we have really policy that doesn't help us at all. So, but the key message here, some opponents to changing policy say that, well, we'll never reach 5 anyway. We cannot get rid of all the cars and industry. This is going to be too costly. We're going to ruin our economies. Well, our key message is that no matter what you manage, even if you reduce from 20 to 15, you'll have major benefits for health. So we push for any reduction at EU level, at any country, wherever they start. It would be beneficial for health. And air pollution effect is huge. And just quickly, not to bog you down too much with numbers, we have these calculations. In 2019, about 300,000 premature deaths in EU were due to air pollution. Globally, this is 7 million. It's a fourth risk factor globally for mortality and morbidity after smoking, diet, and high blood pressure. Since the new WHO report came out, and I apologize for mess up in my slides here, we have higher estimates of association mortality because now we have better, larger, more studies than we had with the last WHO report. So we see stronger association. That means that even more people, we know now better what is the real association. It's stronger than we knew before. So more people die now due to air pollution, even though air pollution is going down in Western Europe, because we know better that associations are stronger than we knew before. And with the newest evidence, this is just European studies. WHO looks at all global studies, Indian and Canadian and so on. But when we zoom into Europe, where we have really good data and good infrastructure and good air pollution models, especially Nordic countries and Denmark, then actually we see even stronger association, and we see more than 600 deaths if we just use local European estimates. So the key message is that air pollution burden is already huge, but it is likely underestimated than the true burden, and we're still getting more studies, more knowledge, as I mentioned, with psychiatric diseases, dementia. These new diseases are not included in cause of death burden analysis yet, and will be in future. Climate change, air pollution, the most dangerous air pollution comes from fossil fuels, for burning oil, petrol, diesel, wood and coal burning for heating. These are also the main greenhouse gases. So the link is clear, and this is also WHO report message that we have to deal with these two issues together, both an impact on health and in providing policy solutions. Perhaps most of you are aware of this. I was just myself at a COP meeting in Dubai. We have record-breaking global warming. Every last 8 years on the record have been one record broken after another. This year has broken more records than ever, and this is not likely to flatten out anytime soon because we're simply not doing enough. Emissions are not being brought down despite a lot of talking, and 20 years of COP, governments are failing to meet the deadlines set up by the meeting. This is regionally, we have even more warming in Europe. This is also something I just recently learned, so not everybody around the world is equally affected. We've seen a number of record-breaking events. I'm sure you also have been familiar with a number of them. So this is really not a doubt anymore. It's just how do we adapt and how fast this is going to get worse. So how does this affect our health? Respiratory patients are arguably in the center of this. They're most responding to most of these elements. Complexities of climate change impact on health is much larger than air pollution. But here are some of the most important factors. So with global warming, with warmer weather, we're going to see more new allergens spread to new areas. We're going to see longer allergen seasons, new mixes of allergens. So this is going to impact respiratory patients that are already asthma, allergic patients or allergy patients to pose new challenges to these patients. We're also going to see new vector-borne viral diseases. We already see now that malaria, dengue fever is spreading much northern in Africa and Caribbean and so on, and this is going to reach Europe for sure in some years with the speed we're going now. Heat waves and temperature. This has been studied the most with respect to respiratory health, and we know that high temperatures as heat wave respiratory patients suffer. The hot air, especially hot and humid air, can trigger a lot of exacerbations. This also leads to increase in ozone. Hotter weather, we have more sun days, we have more ozone exposure, which is important lung irritant. So that's all mixed together. Also droughts. On a very dry day, we see resuspension of dust for the road, and we have this large particles in the air. In the Mediterranean region, we have more sandstorms coming from Africa. They reach also Northern Europe. We've seen the episodes. I think I have a picture down here from Paris in February, where you have the red sand reaching even some episodes to Northern European cities. Droughts and heat are very good elements to cause many wildfires, and this is another huge area. This is going to cause massive air pollution, new exposures. We see massive air pollution exposures to immediate areas, but they're also carried thousands of miles away, air particles with the winds, and pose new challenges. Thunderstorms, flood storms also carry a lot of negative impacts for lung patients, especially flooding increases mold indoors, and that's well known. So this is a complex, and there's of course interaction of many of these factors that are going to pose challenges. Not all of them are studied enough. We have decades of studies on air pollution. We're just maybe 2 decades of studying on temperature and heat waves, but we're seeing increase in funding very much on climate change and health. We've seen very nice example of such a study. It's called exhaustion study, which basically shows that looked in interaction of air pollution and heat on on deaths, from respiratory and cardiovascular health. And they basically find that these air pollution triggered deaths are much higher on the days when weather is also warm. And you see clear dose response across all Europe, but in all cities from Oslo down to Rome, Berlin, we see this, that on hot days there are more air pollution related deaths than on normal weather. So this really turns picture around that one of the best ways to adapt to increasing temperatures, which we cannot prevent or avoid, is really to reduce air pollution. This is additional really argument to reduce air pollution for us to adapt to increasing weather, increasing heat. They see the same for cardiovascular disease deaths, but estimates for respiratory deaths are much stronger. So again, lung patients are really susceptible here. We have published a couple of statements on climate change and health, and also made link with air pollution and health. In these, if you want to read a little bit more, there's a nice overview we provide in our ERS Environment Health Committee webpage. You can find a lot of material and nice summaries of these issues. So to conclude, we have huge amount of evidence on air pollution health effects, both in children and adults, more than enough to act on them. And we know that reduction of air pollution is really for us not just about environment, but this is a major public health opportunity and planetary health opportunity when we consider climate change. And this would is a strict new air quality directive in Europe, but any other corresponding law in UK, Switzerland, US, and around the globe would for sure prevent a substantial number of new cases of respiratory and other NCD diseases. It would make EU citizens more resilient to seasonal influenza epidemics as well as to COVID-19 and like pandemics that we're also likely to face in the future. Cleaner air will also improve life of lung patients as well as heart patient and other chronic disease patients, as well as all of us. And we have this huge indirect co-benefit for our health in cutting down fossil fuel emissions to reduce air pollution with immediate health effects is also the key element we need to help mitigate climate change impacts, both of our planet, our ecosystems, biodiversity, but also in our health. So clean air really for us should be a basic civil right, and we hope that the Air Quality Directive will follow to ensure that nobody gets sick or dies from breathing in EU and globally. Thank you. There are some references. I don't know if slides will be shared. I'm happy to anybody to have the slides. Thank you.